Hi, friends. Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. I've had the pleasure of working with thousands of pregnant moms over the years. And usually what brings them in usually is some kind of back pain, sciatic pain, inability to sleep, mid-back pain. Sometimes if they are a mom that is pregnant and also has toddlers at home, it makes things even more complex. And most times, the vast majority of times, I would say over 90% of the time, the mom feels better at their 38th, 39th week getting ready for delivery than they did when they first came to see me in their 20th week or thereabouts. And always when I have a pregnant mom that's coming in for a different reason than a breech position, is to let them know if you are told along the way that your baby is in a breech position, let me know, because there's very specific things that we can do in chiropractic care with specific adjustments and muscle work to allow the baby to turn on their own. And it's very gentle. It is over 80% effective. There is very specific reasons where a baby will not flip head down. And I'll tell you about those in a minute. And I do have women that come in that have been told by their OBGYN or their midwife that their baby is in a breech position. And a lot of times, if I'm lucky in these circumstances, I have a 2-week window before their due date to work with. Sometimes it's even the day before their due date and their baby is breech and they're coming to me for help. I'll talk about the Webster breech turning technique as it's been known, been called over the years. We'll talk about that in a minute. So now let me tell you why the chiropractic care is so essential to preventing a breech position. I'm going to share a screen with you and show you this image from Google Images. And if you look on this right-hand side, it shows a full-term infant head down with their head in the pelvis of the mom. Okay, so this is ideal position here. And you notice, or you might be aware of, that a baby's head and shoulders are bigger than their pelvis. And in order for the baby to want to be head down, in order for the baby to want to be in that position, there has to be enough space in the mom's pelvic cavity, or else it's literally just uncomfortable. I'm going to screen share again. I'm going to show you the anatomy of the pelvis. And this happens to be from Google Images again. And right here, you can see the wings of the pelvis, the two sides. Now, if you put your hands on your hips, and I'll stand up for a second so you see me. If you put your hands on your hips like that, you're putting your hands on your hip crests right here. This is part of the pelvis. And you notice the central bone is called the sacrum. Well, on either, between the central bone and the two wings of the pelvis is the sacroiliac joints. And those joints have to be able to expand and loosen so that there's more room in the pelvic cavity for the baby. And this does happen. This is a hormonal thing. Further along in pregnancy you go, the more progesterone is made every day by your body. And that progesterone, one of the things it does is it loosens the ligaments so the pelvic can expand. Now, I'm going to show you something else here. I'm going to show you what happens when there's a breech position. Now, there's multiple types of breech positions. This is just one where the baby's butt is in the mom's pelvic cavity instead of their head. And regarding breech or the Webster breech turning technique, it involves just two things. And the two things are making sure that the pelvis is in the proper alignment so that the pelvis can expand. If those sacroiliac joints, where the center bone and the wing of the pelvis, if that is jammed or locked, the pelvis cannot expand. The baby will not have enough space. So that's one thing that is done. It's very specific, very gentle adjustments on the mom's lower back, including pelvis, sacrum, lumbar spine, sometimes even the hip socket joints. The second thing is working on the abdominal musculature and a ligament release in the belly. I'm going to circle back to that too. So with the Webster breech turning technique, and here I am on the ICPA website. This is the International Chiropractic Pediatric Association website, which discusses the Webster technique. I was honored to get to have Dr. Larry Webster as my clinic director when I was in school at Life University. He was the clinic director in our Atlanta student clinic, which was really our outpatient clinic. So I got to work one-on-one with Larry Webster. And I've used this technique multiple times over the years, hundreds of times, if not thousands of times. And it is amazing the differences that we will see overnight with the Webster breech turning technique. And I can tell even when I'm working with a mom and they come in with a breech baby, their belly does not look normal. It does not look nice and round. It's lumpy. It might be lopsided. And it's exciting to do this technique with them. And then the next day, their belly looks different. The baby has dropped. Things are rounder. It's very exciting. Now, there is at least one major reason why the breech turning technique will not work. If the placenta is very high inside the uterus and the cord attaching baby to mom is very short, the baby has what I call a short leash and they cannot get into the proper position. So that's one reason. And there could also be other reasons going on, but I am going to tell you it is such a simple thing to do to just make sure you have a chiropractor all along in pregnancy so you can be working on this as you go. And if something should turn up towards the end of pregnancy, there can be additional avenues that can be explored to give the mom more room in their belly so the baby can be in the position it wants to be. Now, why does this happen to moms? Why does the sacroiliac joint get jammed and locked so the pelvis can't expand? Why is there rigidity in the abdominal muscles? So instead of being able to bow out, the abdominal muscles relax and bow out, the abdominal muscles are rigid and are restricting the baby's free movement. Most of the times it is sports and accidents. Women that have been runners or softball players or volleyball players or anything where there is impact with the ground, whether it's by running or falling, that sacroiliac joint can get jammed. So those women especially need to make sure they have chiropractic adjustments to keep those joints freely movable. The other thing that is a misconception is to stay in the best possible physical condition through your whole pregnancy. And I have an example of that, which I'll screen share again. I'm not going to show you this completely, but you can see the title of this YouTube video is Second Trimester Prenatal Core Workout. Please do not do abdominal exercises during your pregnancy. Do not try to strengthen those abdominal muscles because that will just create rigidity of those abdominal muscles and not allow your belly to expand. You want your belly to expand. You want to allow the baby to be able to comfortably go head down. Another thing I want to discuss regarding safe and safe deliveries that allow you to have the experience of delivering your baby is the Bradley method of childbirth. Like I said, I've seen thousands of women over the years, and I can't tell you how many times I've heard a mom say, well, the doctor says my baby's over 9 pounds now and they want to schedule a C-section. Or, you know what? They said if I go 2 days past my due date, they're going to induce me because the doctor's going on vacation. This is the worst possible thing you can do. This is a natural thing. Delivering a baby, as hard as it is, and as hard as pregnancy is, this is something your body knows how to do. And you may have heard of the Lamaze method, or your hospital that you're going to deliver at might have a childbirth class where you go one evening. Unfortunately, what these classes do is they set you up for intervention. They set you up to be in poor position to labor. They set you up with monitors on the baby. They will fear you into thinking there's something wrong when there's a pause in the labor, when a pause is perfectly natural. And will fear you into thinking the baby is in distress, and then you're in a chaotic state. You are out of your element, and you are being forced to make a difficult decision. And even your spouse or your significant other that is with you, they are at a loss. The Bradley method is a course that takes place over the time of 2 months. It's once a week. It is a lot of information, but it makes you an expert in your own body and your own delivery. And like I teach you in Stealth Health, I wish I had a copy to hold up. In my book, Stealth Health, you need to become your own best expert. You are the expert of you. And on my screen right now, I'm showing this is from a Bradley teacher. Why learn the Bradley method? Because it teaches you about the natural progression of labor and delivery. It teaches you about nutrition. It teaches your birth partner, whether it's your husband, your wife, your significant other, what is going to happen. And that person you will rely on during your labor and delivery when nature has your mind and your common sense, and it happens. You will know about normal phases of delivery, which can be misconstrued to be abnormal if you're in a medical setting. It teaches pain management for the labor and relaxation methods that truly work so you can avoid those epidurals. Yeah, we all want to go through life without experiencing that pain, but I'm going to tell you that is manageable and can be handled. And also, it talks about they teach you about the extreme importance of breastfeeding. So that's my advertisement for the Bradley birth method. It is also a great idea to have a doula. A doula is somebody who is a labor assistant, and a midwife, either one or both, just to assist you in this process to make it the best experience for you, your partner, and your baby. So find your chiropractor. Make sure your pelvis is in the proper alignment. It will help you with your pregnancy and your delivery immensely. Make sure that they do the Webster technique. Avoid abdominal exercises. Let your body relax so that it can have be the best possible conduit for you and your baby to create a lifetime connection. Hope that helps. Bye for now.